this, but it's gonna be a round thing with like rubber, and it's gonna sit under the skin. It's gonna be completely hidden, but you'll just see this bump here, and there'll be a special kit. It's a Huber needle kit to access it, and that's done sterilely as well, just like the dressing change. You get a sterile dressing kit, you get sterile gloves, a mask, clean it with chlorhexidine. And then this whole thing's under the skin, so what you have to do is kind of pull the skin back, feel where the port is, and you'll have some patients with ports that are accessed or unaccessed at the hospital, and you'll be able to see kind of what it looks like. It's kind of, something, unless you've seen it before, it's the first time you see it, you'll kind of understand it right away. But at that point, you pull the skin tight, you figure out where your target is, and then you put your Huber needle in, and then you put a sterile dressing over it, and then there'll be a pigtail sticking out, and you can run fluids through it, you can draw labs through it. The really nice access, if you have them, you have to have a doctor's order to access it. You can't, if a patient has a port, you can't just independently just be like, hey, I'm gonna access this. You have to have an order.
So we can spend more time. I haven't even done IV drugs over there yet.
Okay, guys, let's just stay in this room, and then tomorrow we'll just swap rooms if that's cool.
All right.
Right on. So Portacath.
Tomorrow? Are you referring to us?
Yeah, we have our
tomorrow.
after
Yeah.
the class. We have a couple hours with them again.
It's from Monday.
It's MLK. It's Monday. We don't have school.
We'll send you a picture. I'll send you a picture.
From 1:30 to 5.
This Tuesday and next Tuesday, right?
Mm-hmm.
I don't know.
Yeah.
I think so. I think the 15th and the 22nd.
Yeah, so we have class tomorrow afternoon, and then
It was,
It was
it was on the
yeah.
board for the
But Costa
finals, and they
sent
sent us a
to
picture of
and he
it.
sent it to us.
Yeah.
Thank you.
so Portacath, and usually those are going to be patients that are getting cancer treatment. But if a lot of times patients that are going through cancer treatment end up in the hospital due to complications, and then you can access the port if it's allowed. That's something you have to figure out who's allowed to do it. It's not a terribly difficult skill.
But we're not going to do that.
You're not going to do that, no.
So what you were talking about with you get a medication order, because you're saying that there's 2 lumens in the pipeline right there.
Yeah.
So you're gonna get a medication order then, it's gonna say whatever in distal and then whatever in proximal, since you can give 2 medications in there, or?
Yeah, and really you don't have to worry about the distal and proximal. As far as which medication, you can run either medication through both. But it's kind of good just you want to know which one's which. Sometimes they'll be labeled. A lot of times the kits will just have the labels on them. But really, that point you really don't have to. It's not going to come up so much.
And you can give either any medication through either, because you're always doing a flush afterwards.
Yeah.
Okay.
So you can run, one IV medication through here, heparin through here, and you can run antibiotics through here. You don't have to worry about them touching, because there's enough turbulence in the heart there that it's going to mix instantly. There's going to be no issue.
When we get to the point of administering meds, are we allowed to do lymphatic lines and central lines? Or just IVs?
I think right now just IVs.
Okay.
I'm gonna just double check what TMC allows.
Okay.
But you're not gonna see a whole lot of as much of this on the floor. ICU, you might see a few of these on the floor, but most of what you see is gonna be IVs.
Okay.
The other thing is let's say you have 2. If you just have IVs, you can keep putting in IVs if you need more access points. You can put 3, 4 IVs if you need to. If you've got different medications you have to give at the same time. But usually at some point the doctor will be like, all right, we're ready to go to a central line, just because it's better for it's easier for the patient, easier to manage. For central line dressing changes, this is a sterile technique. And we'll grab our little kit here. There'll be a central line dressing kit. Usually it has a blue cloth in it. Sort of the rule at the hospital is blue towels, blue cloth, is your sterile field. So if you walk in a room and the doctor's got a head covering on and a mask and there's blue stuff out, just like keep your arms behind your back and do not get within a couple feet from the sterile field. Or if you're in cath lab, like you might have a chance to go into cath lab or something like that, just always respect the sterile field, and it's always gonna be blue. So just, I was putting in a midline this week and my aide came in, I had my sterile field out and she was like cleaning up the table, but it was my sterile field. And I'm like, don't touch that. So you have your kit, you'll have a mask for you and the patient. You'll have a biodisc, and this has chlorhexidine in it. Or some of the dressings actually have this gel. If you have the gel, you don't need the biodisc. And you've got your little Luer lock port here. So a couple things you can do, we'll put a dressing on just to go through the process here. This will be one of the things you get checked off on. You'll either do a Foley or a central line dressing. Yeah. And the big thing is, these are just to teach you to respect sterile field more than anything. And be able to work through, a sterile process. This will be
So I have to do an IV then.
or not next week, but the week after.
And the Tuesday, okay?
Oh,
you mean the week after
the
that?
week after, yeah.
Before we go to, okay.
And could somebody hand me a box of gloves, large?
That isn't this, that's just part of that, or is that this?
That's that, yeah.
Oh, okay. Cause the catheter's in there and then this is on the outside of it, okay.
Does the disc have any adhesive to it actually as well as the chlorhexidine?
It does.
Any other antibiotics?
It's not adhesive at all.
Yes.
You should.
So are we just like drawing out of a hat fully or?
Yeah,
Okay.
it'll be Foley or straight cap, there'll be some sterile technique.
If we do the Foley, can we still have the right size gloves, or do we have to use the gloves in the kit?
I think they
It's
should
not a pretty
have,
picture for some people.
yeah, they should have some extra gloves, different size gloves, cause the gloves that come in this kit don't fit me at all.
So you say
Um,
they, does that mean it's not you guys?
So, central line dressing change, you need to make sure the patient can kind of hold still. You put a mask on them and have them, when you're actually changing the dressing, they have to turn their head away from the side. Usually it'll be, most of them are gonna be in the neck. So it'll be here, it'll be here, or even the portacath. But on the neck one, you need them to kind of like tilt their head away, mask. Sometimes if the patient's not really following directions, you can have an aide or another nurse come in with you. They have to wear a mask too, and then they can kind of help keep the neck in the right position. For our checkoff, we're just going to use this site, so you don't have to worry about any of these other ones.